Hello, this is JC Fields. This is for Peds Lab with Mrs. Halter. Today we'll be talking about nasopharyngeal suctioning. So the first thing I'll do is obtain an order and gather supplies. We'll head into the patient's room. I will perform hand hygiene. I'm going to explain the procedure to the patient, and then I am also going to help them into a high Fowler's position. So once that's done, we can test the suctioning on the wall. We're going to turn on the suctioning. So for adults, it should be about 100 to 150. For children, it should be about 100 to 120. And then infants, about 50 to 95. That goes with your facility's policy. So once that is done, we tested the supplies and everything suctioning well, we occluded. Next, we can set that aside and we can begin to open our packaging. Some say this procedure is clean and some say it is sterile, so for the sake of the video, we'll do it sterile. I am opening my package. I'm not touching anything on the inside. I'm just touching a 1-inch border around. So, get that out of the way. Okay, so now I'll be setting up my sterile field. Again, I'm only touching a 1-inch border. So now I'm not touching anything on the inside of this except for my 1-inch border here. I'm going to flip it around here because I opened it upside down. So we can grab this little guy and set it up. I'm going to pick this up. I'm not touching it. It's still inside the packaging. We can go ahead and open up our loop here. I'm going to squeeze this out on the tray with my clean hands. And now we are going to put on our sterile gloves. So I'm not touching the inside of the gloves whatsoever, just the outside. And then once we have them on, we can kind of adjust if we need to, which I do need to. Okay. Again, not touching anything on the outside. So we are maintaining that sterility. I am going to go ahead and get out our catheter set. This is going to be my dominant hand, so this will be sterile, and then my non-dominant hand, my right hand, will be dirty or contaminated. So what I did, I already laid out my lube. We're going to take some water with our contaminated hand. We're going to pour it in here. We are going to pick up our device. We're going to grab the tubing that is also connected to the wall, and we're going to hook that up. We don't have that tubing, so I'm talking through it kind of. So once we have done that, we can go ahead and put our suctioning in the water, and I can control the suctioning with this little suctioning port right here. So we did that and it works effectively. So now that we have done that, I can go ahead and measure. So we are going to measure from the tip of their nose to the tip of their lower earlobe. And this is going to tell us how much we are going to insert. So once we have everything set up and we have it measured, we can go ahead and we already tested our equipment, we can go ahead and roll it around in the lubricant. I'm going to do about 6 inches because that's about how much it will be inserted. So the patient will open their mouth and we will tell them to take deep breaths. I will begin to insert, kind of going at a downward angle. If we feel resistance, we can stop and then try a different nair. So now we are down into the area that we need to be, the bronchus, and that is about 6 inches. So we're in there now. I can control the suction port. As I am pulling it out is when I will be applying that suction. So I'm putting my thumb over the port. So at the same time we're pulling it out, we're rotating it, and this is whenever we're suctioning. And we won't be suctioning prior to pulling the tube out. So we are going to do this for approximately 10 to 15 seconds, and we're not going to do any longer than that because that could cause trauma to our tissues. So now that we have it pulled out, we can clear the line by putting it in some sterile water, and then again using our thumb for that port to turn the suctioning on and off. Once we have that, we can re-put it in lubrication, and we can switch to the other nair and continue to suction that nair, and then we can repeat the whole process. So we can do this, and we can repeat it for a total of 5 minutes before we need to stop suctioning completely because our tissue impairment could be at risk. So now that we are done suctioning, we're going to take the tube out, so I'll instruct the patient to take a deep breath. I'm going to coil the tubing in my hand, and we're pulling it out. So now that I have it all in my hand, I can take off my glove, and this can go into the biohazard. So now we have that done. I can clean up my supplies, I can wash my hands, and then we can leave the patient with their safety measures in place. We can assess the patient to make sure the procedure went well, and then we can go and document. And that is how to perform the nasopharyngeal suctioning.